Welcome, my name is Anwar Smith, and I have the opportunity to present to you guys from our AAOS textbook, Emergency Care and Transportation of the Sick and Injured Essential Package, 12th edition. I'll be presenting on the 12th chapter, Pharmacology. Let's jump right into it. Now, before we jump into pharmacology, we first got to understand some of the competencies we're going to cover throughout the chapter. We got to understand that pharmacology applies the fundamental knowledge of medication that an EMT may assist or administer to a patient during an emergency. We're going to be talking about some of the principles of pharmacology that includes medication safety, as well as the kind of medications used during an emergency. We're going to be talking about medication administration. That includes self-administration, pair administration, or assisting or administering medication to a patient. We're going to talk about emergency medications. That covers topics as name, effects, actions, indications, when you should use it, contraindications when you shouldn't use it, complications, routes of administration, side effects, interactions, and dosages. So now that we got some of the keywords and some of the ideas of what we're going to cover, now let's really take a little dive into pharmacology. Come along with me, guys. Let's start with medications. Medications are an important intervention. Medications can alleviate pain or improve a patient's condition. This is important. Failure to administer medication safely and completely can lead to serious consequences, including death. Now, pharmacology by definition is the science of drugs. Now, like we said earlier, medication is a substance used to prevent or treat disease, similar to your antibiotics. Think about your antibiotics. Those fight against bacterial infections. Medications can relieve pain. I want you to think about your OTCs, your aspirin, your Tylenol. These help fight against pain. Now, when I say OTCs, I want you to understand that means over-the-counter. These are medications you can get from your pharmacy or even your local Chinese and be able to get medications without a doctor's prescription. So another thing we're going to look at is agonists. These causes stimulation of receptors. We're going to look at antagonists. These bind to receptors to block the bonding of chemicals or medications. We're going to talk about dose. That's the amount of measured medication given. We're going to talk about actions. That's the therapeutic effects of medications on the body. I got a couple of big words for you. Say it with me, so I'm going to say it first. Pharmacodynamics. Now you say it with me. Pharmacodynamics. That's a process by which medications work on the body. Got a next one for you. Pharmacokinetics. Now everybody say it with me. Pharmacokinetics. Actions of the body upon the medication or chemical. So now in this section we're going to talk about the onset of action. How long does it take the medication to start working? We're going to talk about duration. How long does the medication work within the body? We're going to talk about elimination. How long does it take for the medication to leave the body and expel from the body? And then we're going to talk about peak. Peak is the point at which the medication is at its full effect. All right, so now we're going to talk about factors affecting medication. Let's talk about the route of administration, as well as we got to talk about the shock states. I want to talk about indications, reasons or conditions to use medication, as well as contraindications, harmful effects. Now, when we're looking at contraindications, you got your absolute effects, you got your relative effects, you got your adverse effects. We're even going to talk about unintended effects, effects that we didn't expect to happen when we use this medication. And then you have your untoward effects. These effects are effects that happen and we have to stop using medication because these are harmful effects to the patient. Now let's get into medication names. You got your generic name. That's your simple, clear, non-proprietary name. For example, let's go with ibuprofen. Then you got your trade name. That's your manufacturer's name. That's the brand name. A good example of that, if ibuprofen is the generic name, Motrin would be a good manufacturer's name for ibuprofen. Another thing I want you to look at is like the type types of medications. We got prescription medications. You need your doctor's signature to get these. You got your OTCs, like we said, over the counter. You don't need a doctor's prescription to get these. You got your recreational drugs. I know you guys know that people be smoking their weed. You got your herbal remedies. That's your plant extracts to introduce healing. You got your enhancement drugs. You got your vitamins and supplements.
Working out, sleeping in, taking vitamins.
Excuse me for a cheap plug. Shadow Fitness Connections, located in Nassau and Freeport. If you're ever looking for your vitamin supplements, multivitamins, individual vitamins, we got those for you. Give us a call or hit me up. I can get you straight. We also got alternative medications. A good example of that is aromatherapy. They use essential oils and plant extracts to attempt healing. It's not biologically proven, but that's what they got going on with alternative medications. Now, there's two important things I want you to remember. We're going to talk about routes of administration. So you got your enteral medications and you got your parenteral medications. When we're talking about enteral, we're talking about medications that enter the body through the digestive system. When we're talking about parenteral, we're talking about medications that enter the body by some other means. Another important thing I want you to note is absorption. Absorption is the process by which medications travel through the body tissue into the bloodstream. Remember that. So let's talk about a couple common routes of medications, or a couple common routes of administration of medications. I'm going to give you the abbreviation, what it means, as well as a little explanation of it. So first we're going to go with PR, as per rectum, a little self-explanatory, through the rectum. You got your AAOS, or oral, that's by the mouth. You got your IV or intravenous, that's in the veins. When you're watching your doctor shows, you're always talking about give them an IV. You got your intraosseous, that's in the bone. You got your subcutaneous, beneath the skin. You got your transcutaneous, that's through the skin. I want you to think about your topical agents or medications. You got your intramuscular. I want you to think about your EpiPen. You got to put that in the side of the thigh. Oh, you got inhalation, so drugs that you inhale into the lungs, directly into the lungs. You got your sublingual. You put them under the tongue. I want you to think about your CBD products to help you sleep. Got that over at Fitness Connection too, actually. And then you got your intranasal, this stuff that introduced to the body through the nostrils into the lungs. So now that we have talked about route of administration, it's important for us to talk about medication form. Why? Because the medication form dictates the route of administration. The manufacturer chooses the medication form for three reasons. One, to ensure proper route of administration, to ensure the timing of the release of the medication into the bloodstream, as well as they want the effects of the target on the body system or organs. So now let's talk about some types or forms of medication. You got your capsules. That's your gelatin-filled shells, usually with powder or liquid. You got your tablets. Those are usually mixed with other materials, compressed together. You got solutions. Solutions are a liquid substance mixed together. Important to know with solutions, though. If you filter them or leave them sitting, they won't separate. Another important note is you can introduce them through intravenous, into your veins, intramuscular, into your muscles, as well as subcutaneously under the skin. Now you got your suspension. These are substances that does not dissolve in liquid. Now these can be filtered out, or if you leave them sitting or standing, they will separate. Liquids or solids could be broken down into small particles or droplets that can be inhaled. That's where your metered dose inhaler comes in. This is a device that can be used to bring such particles from the mouth into the lungs. Important thing to note with a metered dose inhaler, it issues the same dosage every time. Now let's talk about topical medications. I mentioned this earlier. You got your lotions, your creams, your ointments. These are applied to the skin surface and affect that area. Some examples of this for your lotions, you got your calamine lotion. In terms of cream, a friend of mine recently had an allergic reaction. She had to go get some extra strength Benadryl cream. We also got your ointments. You got your Neosporin ointments. Let's talk about some transcutaneous medications. These are designed to absorb through the skin. These can also be called transdermal. and these can cause systemic effects. It's very important to note with transcutaneous medications, if you touch these medications without a glove, these can absorb into your body because these absorb directly through the skin. And next we got our gels. These are like semi-liquids. These are administered through capsules or through plastic tubes. A good example of this is your glucose that they administer to patients with diabetes. Then you got your gases for inhalation. These are usually delivered through a non-breathing mask or nasal cannula, as well as the most, the most common use outside of the operating room, we'd say is your oxygen. I know we've all seen oxygen tanks before. General steps in administering medication. Medication should only be administered under the authorization of your medical control. Follow the rights of administration. Medication errors almost always occur because failure to follow the rights. This is important. I'm going to throw this up on the screen. Let's talk about those rights. The right patient, the right medication and indication, the right dose, the right time, the right route, the right education. The patient has the right to refuse, the right response and evaluation, and the right documentation. All of these things need to be correct in order to follow the right steps of administration of medication. Now let's talk about the circumstances in which medication is administered. You have your payer-assisted administration, your patient-assisted administration, or your EMT-administered medications. This is directed by your state or local laws, as well as your medical control. Oral medications. You must ensure that the patient has a patent airway, as well as is able to swallow. Then you can instruct your patient to swallow the medication or chew the medication. Oral glucose. Glucose is a sugar that your cells use for energy. Glucose is used to treat hypoglycemia, that's low blood sugar. EMTs only can give this medication by the mouth. And it's important not to give this medication to an unconscious patient or a patient that cannot protect his airway. Let's talk about aspirin. Aspirin relieves fever, inflammation, and pain. It inhibits platelet aggregation or blood clotting and is very useful in heart attacks. Some contraindications of aspirin though is like hypersensitivity to aspirin, liver damage or bleeding disorders or asthma, and you never give aspirin to little kids, children. You never give aspirin to children. Sublingual medications. Let's talk about some advantages of these. One, it's easy to advise the patient. Two, quick absorption. Now, disadvantages. You constantly got to evaluate the patient's airway. Do have cause for possible choking, and you cannot give this to an unconscious or unresponsive patient. Now, let's talk about a type of sublingual medication. You have nitroglycerin or nitro. This is used to alleviate angina pain or chest pain. This increases blood flow and relaxes the vein. In heart attacks, they use this to open the coronary blood vessels to allow blood flow. Now, before administering nitro, you gotta check blood pressure. Also, you gotta check with your medical team to get the order, or check with your medical staff or administration to get the order to administer this medication. Now, if your patient doesn't get relief from issuing nitro, you do have a possible MI or myocardial infarction. Now, this should not be used with erectile dysfunction medication. Guys, this is important. Ask your patient if they're using any form of sex, drive, drugs, Viagra. Y'all know what it is. Ask the patient. You know what I'm saying? You gotta get into the nitty-gritty with this one. And then also, this can cause mild headaches. Administration of nitroglycerin. If you're administering by tablet, it'll be done sublingually or under the tongue. You might feel a slight tingling or burning, as well as storage of this drug is important. Now, you could administer by meter dose spray. You would do it on or under the tongue, and it's important to note that one spray would equal one tablet. Now, some considerations with using this drug. You wait 5 minutes before administering a second or repeating the dosage. You would always monitor vital signs. Always wear gloves because this can absorb into the skin, as well as you gotta know your local protocols. Intramuscular medications. So we have our advantages and disadvantages here as well. Advantages: quick and easy access into the vein. Also, it's a constant bloodstream inside the muscle, so you get to introduce the drug right into that bloodstream. Now you do have some disadvantages. You do use a needle with this type of medication, and this can cause the patient to feel like there's going to be pain or feel like they're going to get injured. Now, a common intramuscular medication, epinephrine. This controls the fight or flight response in the body. This is the primary medication with intramuscular medications. Also called adrenaline, and this is the hormone the body releases during times of stress. This increases the heart rate as well as constrict blood vessels. Do not give a patient with hypertension, hypothermia, MI, myocardial infarctions, or wheezing this drug. This may be delivered with an auto-injector to treat life-threatening anaphylaxis. Another intramuscular medication, naloxone. This is used to reverse the effects of any opioid overdose. Important considerations with using this drug: consult your medical direction. Effects may not last as long as the opioid, so repeat doses as necessary. This can cause severe withdrawal symptoms. Consider your safety. Naloxone could also be administered through the intranasal route. This is actually the most common route of naloxone. Now let's get into inhalation medications. Oxygen. All cells need oxygen to survive. Now this is generally administered via non-breathing mask or nasal cannula. You do have MDIs and nebulizers. These take liquids and turn them into mist or spray. The medication you breathe in and it's delivered directly to the alveoli. It's a fast absorption rate, an easy route of access, as well as it's portable. Use a spacer to avoid spray misdirection. They fit over the inhaler like a sleeve. Patient sprays the prescribed dose into the chamber and then breathes it in and out of the mouthpiece. This is especially useful with children. Now you do have your small volume nebulizers. These are easier to use than MDIs, however they do take longer to deliver the medication. They require an external air or oxygen source, as well as they are more effective with patients with moderate to severe respiratory distress. Now let's get into patient medication. Patient assessment includes finding out which medications the patient is taking. This provides vital clues into the patient's condition. This guides treatment, as well as this will be useful in the emergency department. Do not underestimate the importance of taking a thorough medication history. Medications are often not taken as they're prescribed, and medications may alter after clinical presentation. Now we gotta talk about medication errors. This is inappropriate use of medication that could lead to patient harm. It may be possible to minimize errors if circumstances are understood, but you gotta ensure the environment does not contribute to errors. If medication errors occur, these are the following things you must do. Provide appropriate patient care. Notify your medical control. Follow your state and local protocols. Document thoroughly, accurately, and honestly. And also talk with your partner, your supervisor, as well as your medical director. Now guys, I want to thank you for taking this time and just allowing me to share everything about pharmacology that I've learned, trying to take this chapter and just bring it to life for you guys. I hope during this time you were sitting there formulating your questions. I hope some of you guys brought some medications, because I do have some questions for you guys. But this was a fun experience. I had a lot of fun working on this project, and I hope this was a great learning experience for you, because I know I learned a whole hell of a lot doing this for myself. So until next time, guys, we're going to do something else again. I hope we have another opportunity to do another chapter like this, because I can't see learning any better than this. But until next time, guys, be easy.